Being a nurse is often portrayed as a noble and fulfilling profession, but behind the smiles and comforting bedside manner lies a world of exhaustion, emotional strain, and constant pressure. While nurses play a crucial role in saving lives and caring for patients, the challenges they face daily can make the job feel like a never-ending uphill battle. Endless hours and shifting schedules. Nurses are often subjected to long shifts, sometimes extending beyond 12 hours, with little time for rest or proper meals. Rotating schedules that include overnight duties disrupt sleep patterns and wreak havoc on personal lives. It's not just about being physically present, it's about staying sharp and compassionate through sheer exhaustion. Physical strain and constant fatigue. Nursing is not just emotionally taxing, it's physically brutal. Lifting patients, standing for hours, rushing between emergency rooms, and performing repetitive tasks lead to chronic pain, back problems, and fatigue that lingers long after the shift ends. Many nurses feel like their bodies are breaking down far earlier than they should. Emotional burnout from patient care. Caring for people who are sick, in pain, or dying takes an emotional toll that few can imagine. Nurses form bonds with patients, only to witness heartbreaking outcomes. They absorb not only their patients' struggles but also the grief and anger of family members, leaving them emotionally drained and vulnerable to burnout. Underappreciation despite critical role. Despite being the backbone of healthcare, nurses are often undervalued by both patients and hospital administrations. Doctors may get the recognition, but nurses do much of the hands-on work that keeps patients alive and comfortable. The lack of appreciation can make even the most dedicated nurse question their efforts. Low pay compared to responsibility. While the workload is overwhelming, the financial reward often doesn't match the level of responsibility. Nurses handle life-or-death situations, yet many earn salaries that barely cover living expenses, especially considering student loans and the rising cost of living. It's a tough pill to swallow for such a demanding career. Dealing with difficult patients and families. Not every patient is grateful, and not every family is understanding. Nurses often face verbal abuse, unreasonable demands, and constant criticism, even when doing everything possible to help. These encounters chip away at morale and can make an already hard job feel unbearable. Exposure to illness and health risks. Nurses are constantly surrounded by contagious diseases, hazardous materials, and stressful environments that compromise their own health. From flu outbreaks to dangerous viruses, the risk of infection is ever present, and protective measures don't always guarantee safety. Mental health struggles and lack of support. The combination of long hours, emotional trauma, and workplace stress can lead to anxiety, depression, and even post-traumatic stress disorder, PTSD. Unfortunately, mental health support for nurses is often lacking, leaving many to silently cope with overwhelming burdens. The silent heroes. Despite all these challenges, nurses continue to show up day after day, driven by compassion and a sense of duty. But the truth remains, being a nurse is one of the hardest and most underappreciated professions in the world. Until society values them as much as they deserve, the struggles will remain a painful reality of the job.